Okay, go ahead.
The buyer will be West Coast OB/GYN. It's a small clinic in San Diego with 4 physicians. Dr. Smith will be presenting the buyer as the attending physician, and they currently outsource their results to Nationwide Labs, so they only are purchasing the disposable ThinPrep Pap test, the vial, not the actual equipment itself. And they specialize in cervical cancer prevention, so they're very familiar with all these products already. And the pre-approach that we've done before this meeting, the seller received a referral from a colleague of the doctor, Dr. Gerald, and they went to medical school together, and brief phone calls were made to the head nurse, who is identified as the primary gatekeeper, and an appointment was scheduled to further discuss the option of ThinPrep. The goals for our meeting is to ask the doctor to sign a contract for all 4 doctors to use ThinPrep at their clinic. And these test files will be billed to patients' insurance providers once used in the procedure and reordered every 3 months. So here's our demonstration.
Good afternoon, Dr. Smith.
Hi.
My name is Antonino. I represent Hologic Incorporated.
Call me Camille, please.
All right, thank you, Camille. Well, first of all, I'd like to thank you for taking the time out of your busy schedule to meet with me this afternoon. I was actually referred by a good friend of yours, Dr. Gerald.
Oh, yeah. I remember him. We went to medical school together.
Oh, yeah, he told me great things about this facility. Well, first of all, how long have you been working here at West Coast OB/GYN?
I've been working here about 25 years now. It's pretty much second home to me.
Wow, that's impressive.
Mm-hmm.
And what, so this is a PAP test facility? You guys only perform PAP tests here?
Yes, we do. The FDA labeling on my products is really important for me to have.
I noticed that you have here in your office a few of the products that you use.
Mm-hmm.
It seems like they have the approval from the FDA. So that is something, as you just said, that's very important to you, right?
It is, definitely.
Well, I represent Hologic, like I said, and our product is a ThinPrep Pap test system, and we are actually the only product approved by the FDA for HPV, gonorrhea, and chlamydia testing.
Okay.
And if you don't mind, I'm just going to take a few notes here, kind of on the current test that you're using, in addition to some other features and benefits that we'll go ahead and talk about a little bit later.
Well, one second, doctor. You say that you're the only FDA approved?
That's right. We are the only one approved by the FDA.
Hmm.
Currently, we did receive the seal in 1996, which I'll go ahead and discuss later. It's one of our main features of our product.
See, I actually currently use SurePath,
Okay.
and it says right here that they're one of 2 products that are FDA approved. So why are you telling me that yours is the only FDA approved?
Well, SurePath actually is our biggest competitor, and I was going to ask you what your current method is, and I assumed that it would be SurePath.
Mm-hmm.
But the main thing with SurePath is that they didn't receive the approval for the out-of-the-vial testing. They only received approval on their actual smear testing, which is the big difference between their test and ours.
Okay, yeah,
Well,
I do like that feature.
I'll go ahead and explain that in detail as we go along.
Okay.
Do you mind if I just take a few notes here?
Go right ahead.
Please. So my first question actually was, which test do you currently use as your current test method?
Right, well, SurePath.
Oh, so it is SurePath.
Uh-huh.
And what made you choose this method?
Well, I do like the OBT feature, and it's liquid-based, so.
The out of the vial?
Mm-hmm.
Okay, well, I mean, that is a main feature that we have. Did you know actually that SurePath, despite the evidence that you brought forth this afternoon,
Right.
that SurePath actually isn't approved for the FDA for specifically the out of the vial testing?
No, I actually wasn't aware of that. Why didn't they receive that FDA approval for those tests?
Right. Well, the approval wasn't set forth for them. At least they didn't receive the certification because of the fact that they were unable to produce like the cell reproducibility results within their tests.
Mm-hmm.
They could only do it a certain amount of times, and in order to meet that benchmark by the FDA, there's like the cell reproducibility results have to meet a certain benchmark, at least for the FDA to grant the approval.
Okay.
And so they tried 3 times on numerous occasions, and we're not granted that.
Okay.
So does that pose a concern treating your patients with a product that's simply not FDA approved?
Well, it absolutely does. Having FDA approval on, all types of testing is, assures that there's quality and safety, and it's very valuable for me to have in my practice.
I absolutely agree. And in terms of the credibility that it would offer
Yes.
yourself as well as your
For
patients
sure,
as well?
definitely credibility.
Okay, very well. Well, just to go on, let me go ahead and move forward just specifically into a few features that I want to point out.
Okay.
and then we can go ahead and discuss later some values and cost structures you should be aware of.
Yeah, I actually did just have a patient cancel on me, so it's perfect. I do have some
You
time.
have a few minutes now? Okay, great. I brought some documentation along with me. This was one of our, this again shows that the PAP test for ThinPrep was approved in 1996.
Okay.
We've had the approval for over a decade now. Now what this does specifically is it provides you clinical evidence that our PAP test, the ThinPrep system, has met stringent requirements for high quality. In addition to being legally protected, the test itself is legally protected in case of any type of mishap you may have. The ThinPrep PAP test system is protected. You're protected by it from the FDA.
Yeah, that's actually good to know with all the legalities and lawsuits in the medical industry.
Sure.
Really
It's a big, it's something definitely to think about within this field at least.
Okay.
One demonstration I'd at least like to point out to you.
Okay.
I've had this come across about a few months ago with a different client of mine. Imagine you're treating a patient and they came in and told you that a good family relative of theirs recently got a PAP test as well, in which the doctor told them that the results were normal, only later to find out that the results were actually abnormal, and this test, their bodily function progressed into cervical cancer, and unfortunately that patient passed away.
Oh my God, that's so bad.
It was unfortunate.
Yeah.
So if you had that patient sitting in your doctor's office, what would you tell them to reassure them that this wouldn't happen, with the current test that you're using?
Mm-hmm. Well, I would assure them that I would make no mistake, and with my test that I use, I would assure them that I give them the correct results.
Right. Well, I mean, what if instead of that reassurance, you could state to them that you were using a ThinPrep system like the one that I've come to display to you here today, which actually could reduce the false negative results by over 50% compared to your SurePath method that you're currently using here at the facility?
Well, I do like the sound of that, but honestly, I have so many FDA-approved products already. There's only so much I can do to treat them.
Well, that's understandable. Let me make a note to you about another point.
Okay.
Besides the FDA, which we agreed on is of clear importance to you.
Right.
This study that I brought along is by Ms. Martha Hutchinson.
Mm-hmm.
And
I've heard of this study.
Right. So this states essentially about the out-of-the-vial testing.
Okay.
And the fact that our ThinPrep system can produce very good cell reproducibility results,
Okay.
which basically allows you to produce more tests, such as the HPV test, the chlamydia test, in addition to gonorrhea,
Okay.
out of that same vial, as
Okay.
opposed to having a patient come back and retake their test. You have all the information present in that vial. Does this out-of-the-vial feature something of importance to you?
It most certainly is. It's important to be able to detect diseases earlier on and then, begin treatment. That's extremely pivotal.
Now, would this be pivotal for all your patients specifically, or would this, or maybe?
Yeah, I think this is actually great for my high-risk patients,
Right.
where, earlier detection is good to have so we can begin treatment right away.
And would you say maybe only for your high-risk patients, or maybe in general you use it in your practice?
I think for all my patients, having the source of, quality and credibility is definitely valuable to have in my practice.
I mostly agree. Well, I'm going to leave this study with you on my way out,
Okay.
in addition to this clinical evidence which you could take a look at.
Okay.
But I'd like...
I do have one thing though, although,
Right.
all this sounds great,
Mhm.
with all the added features, I'm worried that the execution time from switching to SurePath to ThinPrep might increase substantially.
The execution time, you said?
Yes.
Well, I understand how you feel.
Uh-huh.
Your friend Dr. Gerald actually felt the same way.
Okay.
But upon implementing the ThinPrep test, he actually took it on. He actually found that he had additional time to perform tests within the facility, and this was because of the reduction in inconclusive test results due to using our system.
Okay.
So I could break this down for you, so you can understand kind of what I'm talking about in terms of time in addition to cost.
Okay, great.
First and foremost, do you know the percentage of inconclusive test results that you currently have here?
Roughly, it's about 7.5% of inconclusive tests annually.
Okay. Well, that is actually, that is the national average.
Okay.
And the main thing with our ThinPrep is that we're able to reduce that percentage by 2.5%.
Oh.
Now, just a few other figures I would need to do my simple calculation.
Mm-hmm.
For one, how many tests do you perform here on your own per month?
Around 200 procedures.
200, you said.
Yeah.
And this is procedures per month?
Yes.
Very well. And the time roughly to administer each one of these tests?
Approximately 30 minutes or so.
Half hour of time.
Yep.
So now, if we go ahead and take your 200 procedures that you perform per month and multiply that by the 2.5% that you would save using our ThinPrep system, this would save you on 5 retake tests per month. Now, at 30 minutes per visit, 5 retake tests times the 30 minutes gives you 2.5 hours just for yourself, doctor, that you'd be saving per month. Now, here at West Coast OBGYN, so was there 3 physicians?
4 actually.
4 physicians. So you take the 2.5 hours that you'd save, multiply by 4 physicians, and you're saving over 10 hours of time per month by using our test. Now, on an annual basis, doctor, this is 120 hours per year, or almost 3 work weeks of time.
Wow, I could have taken that trip to Barbados if I always wanted to do.
That's right.
It's good to know when you break it down like this.
One other figure, doctor, that I'd like you to be aware of, consequently I feel being the most important, is the death rate. Last year in the United States, on a nationally speaking, and then we'll break it down here for West Coast,
Okay.
there were 4,100 deaths caused last year due to cervical cancers, out of a total 51 million procedures that were performed, Pap test procedures performed. This equates to a 0.01% death rate. Now, this may seem like a small percentage,
Yeah.
but if we go ahead and convert this over here, reflected onto your practice, let me show you what happens.
Okay.
Once again, you said 200 procedures are done per month. Let's do that annually. That's 2,400 annually. 200 times 12 is 2,400.
Right.
If you go ahead and multiply that by the 0.01% death rate, unfortunately 20 patients that you treated last year out of the 2,400 passed away. Now our test, the ThinPrep test, is known to reduce the death rate by an astonishing 28%.
Okay.
If you take the 20 patients and multiply that by the 28% reduction in death rate that I'm offering, you could have saved 6 lives last year, doctor, by using our system. Now, once again, 4 physicians here at this practice, 6 times 4, you're left with, it equates to 24 patients that could have been saved here at West Coast OBGYN.
Wow, these figures are really unbelievable.
It's quite astonishing.
Yeah. So yeah, this seems to be good that, or I agree that this would save time and lives.
Right.
But I'm actually concerned with the insurance coverage with switching.
Insurance coverage?
Mm-hmm.
Well, what exactly are you concerned about regarding insurance coverage?
I just heard that there was a lot of switching costs involved, and I don't want my
Okay.
patients to have to hassle with that. I don't want to lose them.
Okay. My previous client had the same issue in terms of switching, and I explained to him that, on the contrary, there should be no switching costs. And reason being is that your current method, the SurePap Pap testing that you're using,
Right.
Falls under the same CPT code as our ThinPrep. Now, a CPT code is the code the insurance providers use in which you bill them for the services and practices that you provide, and then they can cover the cost.
Okay.
So our method and your current method of SurePap being under the same code, cost should no longer be a concern.
Yeah, you're right. If it's done identically, then cost really isn't a concern. Okay.
And so cost is no longer a concern. Is there anything else that's bothering you, or that's really giving you an issue?
Well, I would order for myself and all other 4 physicians, but I'm just still not sure if I want to make that switch to ThinPrep. I do need it on Monday. I have a lot of patients coming in, and
Okay. Well, but you would be interested in getting it for all physicians in your practice, not just for yourself, correct?
correct.
Okay. Well, how about this? Just to go over kind of what we've done so far,
Okay.
I just want to recap the fact that FDA approval was very important to you. In addition to the mathematics I broke down in terms of the hours and time you would save for yourself and the valuable lives you could have saved.
Yes,
Is this true?
this is very true.
Now, the only other concern you said is the delivery date?
On Monday, yes. I'm just concerned
Okay.
with the downtime due to switching.
Okay. Well, unfortunately, I wouldn't be able to have my delivery scheduled to your area until Wednesday mid-morning, probably around 11 o'clock. But I brought a few samples with me just so you could take a look.
Okay.
In addition, I have a few boxes in my car
Okay.
of the Pap testing that should hold you over until the Wednesday delivery. And
I
then,
do see the FDA labeling.
right.
Good.
It was right there.
Uh-huh.
So I do have the boxes in my car that should hold you over until Wednesday morning, and then we can go ahead and proceed from there.
Sounds good. Do you have a...
Do it. If I could just show you here, This is our order form that we use here at the Logic.
Okay.
This describes our standard 3-month supply for yourself. You've noted 4 physicians, and you make note 4, and you said roughly 200 tests.
Right.
So we're looking at a total of 2,400 tests you need for those 3 months. If you could just go ahead and please verify your name, address, and phone number, and sign below on the X.
Sounds great.
Very well, doctor. Well, I'm gonna leave just this as a quick reference for yourself, just some more information about also what to know to tell your patients before they come in addition to things that you need as a physician to prepare for the appointment.
Perfect.
In addition to my personal business card, if you have any questions or concerns, please feel free to ask.
All right. Thank you.
It was very
It's been
good doing
great
business
with you.
with you.